Hi, I'm Dr. Chouraeshkenazi, a licensed psychology resident and clinical neuropsychometrician. Today I would like to debunk some of the biggest myths that I've encountered during a mental health evaluation. So if you're just curious about the process or if you're even thinking about getting evaluated, this video is for you. So let's clear up some of those common misconceptions. Myth 1, if I get a diagnosis, it means something is wrong with me. A diagnosis doesn't mean that something is wrong. It's just a matter of understanding what's going on with your thoughts, emotions, behaviors, and even your cognitive functioning like attention, memory, or problem solving. So many evaluations include tools that assess cognitive performance. So it's not about just how you're feeling, it's about fully understanding your mental and cognitive health, not labeling or judging you. Myth 2, I need to pass or fail the evaluation. Mental health evaluations are not based on pass or fail, and there's no grade or gotcha moment. They're specifically designed to help you, not judge you. So we're focusing on strengths, weaknesses, or just ways that we can improve your mental health and help you pursue your mental health goals. This is not to label you unfairly. Myth 3, if I tell the truth, I might get locked up or lose my job. Now, this is a very real concern, especially among military members, law enforcement, or even emergency responders. These roles require either security clearances or strict psychological standards to stay in their roles. Now, understandably, they may worry about being honest on the evaluation could affect their job status. But I'm here to let you know that just by seeking an evaluation or just simply asking for help does not automatically lead to disqualification. In fact, many organizations are starting to see the importance of mental health for job performance and safety. Now, there's still a strong cultural stigma in these professions. They're often built around strength, control, and reliability, which can make admitting to stress, anxiety, or even trauma risky. But the truth is, mental health care is part of peak performance, not a sign of weakness. It's also important to know that mental health evaluations are usually confidential, but not always. There are legal exceptions, such as if there's a risk of harm to yourself or others, or if the evaluation is actually court-ordered, which limits privacy and confidentiality. Now, these are serious situations, and I'll go more in depth in confidentiality and legal limits in another video. But the takeaway from this is evaluations are here to help. They're not to trap or punish you. Myth 4, all mental health diagnoses are permanent. Not always. Mental health is fluid, so some conditions can improve over time or with treatment. Remember, an evaluation is just a clinical snapshot at that point in time. So when we do evaluations, we're looking at the situation that you're in at the moment, but it doesn't define your entire future. Myth 5, only people with serious problems need an evaluation. Evaluations are not just for crisis moments. People seek them out for all types of reasons. Anxiety, depression, attention problems, work burnout, the list goes on. It's just simply of understanding themselves better. And remember, it's a form of self-care, not a last resort. So to sum up, mental health evaluations are not about judgment. They're about understanding, support, and clarity. If you've been holding back simply because of fear or these myths, I hope this video has given you some new insight and a new perspective. If you got any questions, please feel free to drop them in the comments. I would love to answer them. And if you found this video helpful, please like, subscribe, and share this with someone that you think might need to hear this today. Thanks for watching, and remember, seeking help is a strength, not a weakness. See you in the next video.